basically, we are just a clinician, as Jonathan was saying. We are not academician. We are not like professors and teaching is not like my forte. Our forte is to be work with patients, help them, see what you can do to get them better. This is all our basic intent with Ayurveda, nothing else, purely. And I think that is what we are doing all these years, whether it was in India, whether it was in Europe, whether it was in United States.
My name is Simon. I'm a big fan of Ayurveda, and I've studied with the best, Dr. Vasan Lad and Dr. Sunil Joshi, someone whom I can wholeheartedly recommend, both for Panchakarma, which is the extended deep healing therapies, because he literally wrote the book on it, and for masterful pulse diagnosis, in which as I mentioned earlier to the class, he doesn't ask any questions. In fact, he doesn't want you to tell him anything. He takes the pulse and he tells you everything. And in fact, he'll even tell you things you may not know are there, and then later you check it out and in fact you have those issues. So that's been my experience. I'm looking forward to seeing him again, and I can wholeheartedly recommend to anybody who wants a real Ayurveda to come and experience the classes and maybe even get a session.
Thank you. Thank you, sir.
Hello, I have been a patient of Dr. Sunil Joshi for several years. When I first consulted him, he was able to give my complete medical history just by reading my pulse. He also discovered certain conditions which I did not know about but were confirmed by an MRI later. Dr. Joshi has helped me a lot with my metabolic health. He has helped me to normalize all my parameters and get back to a normal weight. I felt so much better when I was under his care. Please take this opportunity to consult with him. He is the best Ayurvedic physician I have known. This is an opportunity not to be missed.